Wonderful. So welcome everybody to another wonderful night with Dr. Catherine Willow, talking about German New Medicine, and tonight's focus will be about alternative perspectives on cancer, which is going to be fascinating. I'm very excited to learn more about this and to have the information about German New Medicine being spread to everyone, as many people as possible. So thank you very much, Catherine.
Thank you, Rebecca. So now I'm going to get you to I'm just going to move. Let's see. Figured it out. So I'll get you to introduce yourself and lead us in a sound meditation.
Sure. Just a little brief thing. So yeah, I'm Rebecca, and I live in Ottawa, and I love to work with sound as a way to help us relax, to center, to heal, to meditate. And so with that, let's take a few moments to slow down, let go of our day, focus on our breath. Let our bodies get heavy. Feel grateful for this life.
Thank you. Good way to start. All right, so for this one, I've slipped in a disclaimer because, especially for cancer, I wanted to be really clear that this is educational, that you really can't just take this webinar and go create a cancer plan for yourself. It's always slightly different for each individual. So, you know, if you're interested in using it, make sure you have a practitioner and maybe collaborate with your regular practitioner and a German New Medicine practitioner. If you're a practitioner, also, this is not enough to treat any client or patient. You really have to do a lot more studying. So this is kind of an introduction, a 101, and then you can go further with that. And I'll have resources at the end about how you can do that. Okay. So, introduction. So, my background is I'm a fourth generation naturopathic doctor, and I graduated from NCNM in Portland, Oregon in 1983. And I've been practicing in Ontario ever since, and I work at an eco-wellness center, Carpridge Eco-Wellness Center, which is about half an hour from Ottawa. And we have a clinic with various practitioners. We have an organic bed and breakfast where people can come for healing stays. They can get an integrated program, which includes German New Medicine. We also have programs people can come and learn through, spiritual programs, meditation. We do cleanses and retreats. And the land is 190 beautiful acres with all kinds of trails. And we have plans to make areas where you can meditate out in the woods. We have a yurt and come and do earthing and get sunbathing. So lots of plans. And it's a lovely place to live. So this is what we're going to do today. I'm going to start with a case. I want to talk about how German New Medicine started with Dr. Hammer. I'll tell a bit about how it started for myself. And then I'm going to go through Dr. Hammer's 5 biological laws, which are the foundation of German New Medicine, and take each of those apart and apply them to cancer. Then we're going to look at how we would generally use German New Medicine with cancer in clear steps. We'll do a little bit about integrating German New Medicine with mainstream and alternative practitioners and go on to resources. And then Rebecca will host the Q&A and do a final sound healing. So a startling case over tea. So this is quite early in my career, before I learned German New Medicine. I had just moved to Constance Bay, and a neighbor came and knocked on my door to welcome me, and I invited him in for tea. He was a chatty middle-aged gentleman, and happened to mention that he had pituitary cancer and wondered how I, as a naturopath, would treat it. And of course, at that point, I didn't have very much experience with cancer, and so I was just able to give him a few lifestyle tips. And that was that. And then, to my astonishment, 3 months later, I meet him on the street, and he said, "You know those tips you gave me? My pituitary tumor is absolutely gone." So that was one of my, and I had many startling cases like that, where I got glimpses of how easy it can be to treat cancer. So let's talk about the origins of German New Medicine. And that is totally based on a brilliant medical doctor from Germany, Dr. Rike Gerd Hammer, who unfortunately we lost 3 summers ago. And what happened with him is that he was brilliant from the get-go. He was one of the youngest students to ever graduate from medical school, and then he had a second doctorate. He patented surgical equipment, and that allowed him to travel to Italy and treat people in the slums for free. And then what happened was a tragedy. His youngest son, Dirk, was accidentally shot and killed. And what happened after that is that Dr. Hammer developed testicular cancer. And he made the connection between this terrible shock and the cancer because he was a robustly healthy man. But we already know that. We already know, we have lots of research that shows that shocks precede cancer. But he went further. He said, I'm getting this shock, I'm perceiving this shock with my mind, my brain, and then I'm having a physical manifestation. I wonder if we can see something in the brain. And he just happened to be working in the cancer ward in Munich, the Munich hospital. He started taking brain CAT scans of his cancer patients and noticing that they had these ring formations. And we'll talk more about them later, but it turns out that these ring formations predicted where the shock would manifest in the body, and not only where, but how. And he went on through very astute observation. I mean, it's so amazing that he didn't stop. He just kept going and unraveling more and more pieces. And that's what we're going to do. We're going to follow his tracks today. He ended up with, they say, 20,000 cases that demonstrate German New Medicine. And now there are thousands of German New Medicine practitioners all around the world doing his work. My introduction to German New Medicine started with my husband, my second husband, who I married in 2000 in the summer. And then in the fall, he started to have seizures and was diagnosed with brain tumors. At that point, I didn't know German New Medicine, and we did all kinds of naturopathic therapies. All his symptoms stopped, but because I still had the old paradigm of cancer in my mind, we imagined these brain cells just growing and kind of eating his brain from the inside, and we were in huge shock around it. And finally, we gave in and had Mickey have brain surgery, after which all his symptoms came back and were much worse. And in the middle of all of that, one of my patients handed me Dr. Hammer's thesis, which unfortunately is out of print, and demanded that I read it. And we started going to Germany for treatments. And on the plane to Germany at 1 o'clock in the morning, I finally started to read this book. And I still remember, I mean, all my hair on my whole body stood on end, because it was a totally different view of cancer, and it made total sense to me. We got to Germany, looked up Dr. Hammer, and Dr. Hammer said, well, he has 3 tumors. They're related to these 3 areas in his body and these 3 issues. And unfortunately, again, we were so upset, we couldn't use German New Medicine clearly. And in a way, that was a good experience for me to have, because it makes me very sympathetic when people come to me, that it's a hard new concept to wrap one's mind around. So we lost Mickey in 2002, and we had an autopsy done, and the autopsy proved everything that Dr. Hammer had predicted. And so I went on to study German New Medicine very intensively for a year, and started to use it in 2003, and immediately started seeing amazing results, not only with cancer, but many other conditions, and finally published a book last year about my experiences. And the book is not only to explain German New Medicine, hopefully clearly and simply to people, because it's not that easy to get, but also to have something I can give policymakers and medical doctors, because we're not going to move forward with integrating it into mainstream medicine without research. So the book is also a call to research. So that's where I'm at now. And so now I use it. I'm still not a specialist, which I'm not a sole German medicine practitioner. I'm a general practitioner naturopath who integrates German New Medicine. I'm also not a specialist in cancer, but I see a lot of cancer patients. Okay, so this is something I developed for anybody who wants to use German New Medicine. And unfortunately, I developed it because of failures, people who didn't see cures, didn't see good progress with it. And so I'm going to go through these, because German New Medicine is absolutely not for everyone. And if once you know it and you're wildly excited and you think everybody should do this, please remember that it's probably, that's why we need the research so badly. Once we get the medical people acknowledging that this is real and that it works, then it can start to be for everyone. So the first requirement is that people have a clear understanding of German New Medicine and how it applies to their situation. GNM is not a faith-based process. It's based on common sense and understanding. And when people read it and go, that makes total sense, they're good candidates. People who go, that's really opposite to what I'm told, and it is, opposite to what we thought we knew about disease, that's not such a good candidate. The second thing is to have supportive people around you, and especially the people you live with and the people that are closest to you. Because once you go through German New Medicine, and we'll talk about this today, the healing process can be quite fatiguing. And we lose our strength for a little while, or it seems like we do. Our strength is actually being used for repairing issues in our body. So we need people to carry us for a while. And if we have people around us who are afraid, it's very contagious. So that's always an issue. The third thing is vital energy. In order to heal, we have to have a certain amount of physical energy in our body. So I vividly recall someone who came, she was working with another one of our practitioners and doing German New Medicine. And she was very excited about it. And I was called in to just help with the assessment, and I took her pulse and instantly knew that this wasn't going to work because the pulse was hyper and low. So hyper and so low I could almost not feel it. And so I realized that all this woman's energy was mental, and she wasn't going to have the physical energy to get through the healing process. Now, having said that, there's a whole other part of me that's dedicated to healing into death. And so dying is not a failure for me. And after this woman crossed over, I was able to see her in glowing light. And she was one of the most amazing people on the other side. So there's all of that, which is not German New Medicine, but I just wanted to slip that in. The fourth thing is also crucial. It's the ability to identify and process emotions or be willing to learn. If one hasn't paid attention to one's emotions, in fact, we just kind of live up here in our mind, it's like going into a dark jungle where one has never been. And, you know, if one is asked to visualize or to meditate or to even identify what one is feeling, it can be totally foreign to some people. And you'll see that German medicine is based on these biological shocks. And if we can't identify them, if we can't identify how we're feeling, if we can't resolve our emotional pain, it's very hard to use German medicine. Although in some cases, and you'll understand what I'm talking about later, when it's a healing cancer, this isn't as important. The fifth one is the willingness to change to a healthy lifestyle or to improve one's lifestyle. And it's especially important, not diet as much as sleep. Sleep is when we heal, the early part of sleep, and also to relax. The relaxing part of our nervous system is when we heal. The sixth one sounds a bit counterintuitive, and that's the acceptance of death having one's affairs in order. And kind of not having that fear of death be back there, but pulling it in front and going, okay, if I die, this is how I want things to be. In other words, one's will, of course, but also to face one's death, because once we're not afraid of dying, we have all that energy that we can use towards healing. So we sometimes have death tea parties where we discuss death and the silver lining of death, and that we go on. I have all kinds of stories that I tell to try to help people see death as an interesting adventure instead of a failure and a disaster. The seventh thing that is very helpful for having success with GNM is for people to have the courage to ask their medical practitioners to modify treatments. And mostly what that looks like is postponing treatments so that the body has a chance to finish its healing process. So I'll have various stories about that. And that's a tricky one because I of course always like to practice without burning bridges. I like to practice as a team. I'm very much a team player. And sometimes other practitioners are not there. So that makes it very hard for patients. So that's just something we have to keep working on into the future. Okay, so let's dive into this. We'll start with GNM Law 1. And this law tells us that when there's a biological shock, which I will explain soon, it creates a lesion in the brain, which is a ring formation called a target ring, which then creates a response in the body. And that response in the body is trying to help us. So all of these things that we thought are diseases, which are bad, are actually in disguise. They're trying to help us deal with these biological shocks. So what's a biological shock? A biological shock is something that's unexpected, something we're unprepared for. It's sudden, it's acute, serious. We end up being isolated. And it hits us on some level, on a primitive survival level that usually we're not aware of. So this shock creates a lesion specifically somewhere in the brain, which will then create a response in the body. Now, where that lesion ends in the brain depends on how we respond to the shock. So it's not like a certain shock always creates the same lesion. It's how we respond in our psyche. So for instance, if our partner suddenly leaves us, we can respond with anger, which can hit our digestive system. We can respond with grief and loss, which will hit our breast ducts. It can hit worry for our finances, which we call a starvation conflict, which will hit our liver. So it's interesting, when we have a diagnosis, then it tells us what kind of shock led to it. So I'm just going to check my notes here and make sure that I've got all these pieces. Okay. So examples of biological shocks would be sudden deaths, sudden losses, a job loss, a sudden separation, especially if it's unexpected. It can be something dangerous. It can be somebody getting shot. It can be a mugging, I've seen be a shock. It can be a sexual assault. So almost anything that puts us into survival mode. And these survival modes, these vulnerabilities are usually set in childhood. So we're already primed for how we respond to things. So here we have 2 brain CAT scans, which show these lesions. So you can see in this one, you can see the clear target ring. And then you can see here, we have a much bigger one going all around. And so the size of the target ring, which in German is Hammerschenherde, HHs, which his colleague, Dr. Hammer's colleagues, coined those as to tease him. And these brain CAT scans are done without contrast. So we don't do brain CAT scans a lot, just if the situation is confusing and we have to figure out what's going on, will we order a brain CAT scan. And I, of course, can't order a brain CAT scan, and I ask the patient to ask their medical doctor for it, and if they won't do it, I have a connection with a hospital just across the border in New York who will do it for cost. Okay. So another concept that Hammer discovered was the concept of handedness. And he noticed that when a symptom was on one side or the other side, that it would relate to a certain type of relationship. And it wasn't right or left, it was dominant and non-dominant sides. So he noticed that if you could discern what your handedness was, because it's not always what you write with, it's your neurological handedness. So some people, it's more common if people write with their right, but they can also be left-handed and they switched. So if you want to find out, you clap with one hand on top of the other and then switch them and ask yourself what is most comfortable. So you can go ahead and do that to notice what your handedness is. Also, another way to determine it is which arm would you hold a baby in? And you would hold the baby in your non-dominant arm so that you can do more complicated things or hold the baby underneath to hold it up with your dominant hand. Another way you can tell is by stepping forward, and you would tend to step forward with your dominant leg or foot. So now how this plays out in relationships is that our dominant side is related to anybody close to us, except mother and children. So dominant relationships can be father, spouse, cousin, sibling, best friend, close co-worker. And non-dominant side is always mother, children. It can be a pet, but pet can be either side depending on how we regard our pet. If it's a pal, that would be our dominant side. And if it's our child, it would be a non-dominant. They can also, of course, cause shocks. So some case examples would be breast cancer. So we had a case, which I will actually explain more about later, who had a worry conflict about a child, and her left breast developed a lump. With MS, that's what we call a motor conflict. It also responds to handedness. And there was a mother whose child had jumped off the balcony, and the mother couldn't grasp the child with her arms, but it was only her non-dominant arm which had the MS. I have here eczema. So eczema responds to separation, but the actual rash shows up in the healing phase. So a few years after Mickey died, I had this palm-shaped rash on the right side of my body, on my torso. And it's always where he held me when we would go for walks. But it would be either side. He could hold me on either side, but it was only on the right side because that's my dominant side. And I was getting over that separation to touch. And Molluscum Contagiosum was a great teaching story for me. I won't tell the whole story. It's in the book as well, and I probably tell it way too much. But it was a young boy who was brought with little warts. That's what Molluscum Contagiosum is. It's actually not contagious, and it's supposed to be not curable, and it may go away in 3 or 4 years. And this boy had a separation conflict with a sibling over which there was a custody battle. So when the custody battle was solved, very soon thereafter, the boy developed these warts because the warts are in the healing phase. And when we had clarified that, the warts were gone in a few days because it was resolved in the sense that the mother no longer worried that this was a disease. She realized that it was a healing because the timing fits so well. That's why it's so useful to be able to find your shock and see if you've resolved it. If the timing fits, it really helps. Okay. So case example for the first law. So I'm going to use lung cancer, and lungs, the alveoli, so the part of the lungs that actually absorb the oxygen, respond to the shock of fear of a death fright. And it can be for oneself or someone close. So if we're afraid, if we get a death fright for ourselves, which can sometimes come through a cancer diagnosis, we'll get many little nodules. If it's for someone else, we'll have 1 or 2, maybe 3 nodules. And these grow immediately after the shock, and they stop growing when the shock is resolved. So in this case, a middle-aged woman comes and says, I've just been diagnosed with lung cancer. They want to take out half of my lung. Can you help? And I immediately asked her, one lump or many? She said, one. So I said, do you have somebody close to you that's dying? No. Recently? No. 3 years ago, my mother died. So I'm thinking, what happens with German New Medicine with this pattern, with this program, is that if you have a fright or a fear of someone dying and they actually die, that fear is gone. That nodule also stops growing because it's resolved, it's over. There's no need to be afraid anymore. And so I thought to myself, well, that lump is stable. So I asked her, you know, you probably don't have any symptoms then? And she said, yes, it was caught on a routine x-ray, but I have this tension on the right side of my chest. And at that time, I thought that lungs responded to handedness. They actually don't. But in this case, I got lucky because I asked her, well, isn't the lump on your left side? And she said, well, how do you know that? And so then I said, well, you really don't have to have your lung out or your half of your lung out, but you have to learn German New Medicine, which is one of the criteria. You have to understand it. It has to make sense to you to be able to use it. And so she came for one visit and I said, you're absolutely healthy. Just learn this and you go back to work. But I said to her, once she had learned it, and it still made sense, it did make sense to her, and she did want to use it because she did feel totally healthy. You know, I might as well mention this now. When I was in naturopathic college, we learned that cancer was a result of poor health. But you get people in brilliant health who get cancer. So it's not about that. It is about these shocks. So I advised her to not burn her bridges with her medical people, but to postpone the treatment, but to get scans every month to satisfy herself that it wasn't growing. And she did that. She never had any symptoms, no coughing blood, nothing. And basically that one phone call, the class, and one visit was the cure for her lung cancer. And I call people every few years and ask them if they're still alive. And she's totally fine every time I call. So that's an example for the first law. Shock, body trying to do something that helps you because it's growing more air cells to get more air into the body. That's a response to a death fright. So here is part of a graph, which I don't know how it is in your view. Can you guys see the whole graph? Because I see everybody's pictures on top of half of them. Rebecca? Oh, she might not be there.
Yes, we can see it.
Okay, that's great. So I don't know how I'm going to do that. I don't know how maybe I can put them on the top. Now this is something I should have figured out before because I don't want to wreck the whole. Okay, so here, this graph, okay, the top part of this graph is sympathicotonia. And what that big long word means is the part of our nervous system that responds to the fight or flight. So it's the stress part of our nervous system. And the bottom part of the graph is vagotonia. So it's the relaxed, rest, restore part of the nervous system. And our daily rhythm goes like this. We wake up in the morning, the cortisol rises, our stress goes up a little bit just to meet the day. And then it gets to be about 4 o'clock in the afternoon, the energy starts going down, and it keeps going down, and our body wants to sleep. During sleep is where we heal the stress damage of the day, and then we do it over again until we get a DHS. A DHS is German New Medicine terminology for a biological shock, and it's to honor Dr. Hammer's son. It's the Dirk-Hammer syndrome. So we have a shock, and we go into some degree of sympathicotonia, of stress. And we have 2 levels of symptoms when that happens. We have stress symptoms, which means we tend to have cold hands and feet. We lose our appetite, don't digest our food very well. We have trouble sleeping in the sense that we wake up too early in the morning. And the biological reason for that is that it gives us time to resolve our shock. We tend to feel isolated, don't want to talk to people, want to be alone. And then there's a specific symptom, and that goes with the type of shock. And we'll get more into that as we go along. So let's go to Law 2. Dr. Hammer kept observing his patients. So he noticed that they had certain shocks which caused certain problems in their body, but then he kept watching them. And he noticed that when people resolved their shocks, that they would start having a completely different set of symptoms, things that were considered different conditions altogether. He was the first person who put all of this together, except for maybe some homeopaths. So the two possible phases are the active phase, while we're still in shock, and then the healing phase, if there is a resolution of the shock. And what happens often is that the healing phase can be chronically relapsing. Often we're unaware that we've had a shock. We're unaware that we keep being triggered into the shock, and that keeps us from fully resolving it. And part of, we're going to go into this in a moment, but inflammation is part of healing. And if the healing if the healing phase doesn't finish, we go into chronic inflammation. And there's a lot of talk about chronic inflammation being the source of our conditions. And it's a bit of a wrong direction from the point of view of German New Medicine. So there are a lot of natural therapies that people do with diet and with herbs to decrease inflammation. From German New Medicine point of view, what we want to do is resolve the shock, and that inflammation will then stop. So things like the fibromyalgia, somebody was asking about that, would be something like this. So here's the graph. It's going to be tricky because I can only see half of it, so I'll do my best here. So here we have the daily rhythm. Here we have the DHS, or the shock. Here is the first phase, from the point of the shock to the point of the resolution. And the CL is the German New Medicine term for the resolution, is conflictolysis. So breaking the conflict. So in the healing phase, you have two dips. So it's healing phases A and B, and in the middle there's a spike. So we're going to talk more about that now. So more specifically, in the active phase, we have these general symptoms: fight or flight, cold hands and feet, appetite, sleep, preoccupation with the shock, and then we have specific symptoms. But the very interesting thing that we notice for the active phase is that we don't have a lot of specific symptoms. So for instance, if we have a lung cancer, we won't notice that right away. Prostate, uterus, digestive cancers, the lumps grow. They're trying to help us with something, but we don't notice them that much in the active phase. And I'll explain that as we go along. What if the shock is not resolved? And this is actually quite common. We're not yet a culture that understands healing very well. So what can happen is it can be downgraded, but still active. That's the term suck it up. This is very common with childhood trauma. Just get over it. Just push it down. medicate it, numb it, distract from it. It's active, it's driving our lives, but not making us sick, not obviously sick, not immediately sick. The second thing that can happen is much more serious. It's basically death from cachexia, which is starvation. And you see this in some cancer patients who get really thin and then pass away. And that's not the cancer. What that is, it's such a deep shock that the nervous system has shut down the digestion, the sleep, the absorption. So they can't absorb food anymore. So the cancer doesn't do that. That's the nervous system. That's a general symptom. So, people can actually die of a broken heart, for instance. The separation, the loss of somebody, for instance, is so awful that they can't eat, they can't sleep, and they wither away. Now, this is not very common, but it can happen. So then we look at the healing phase, and counterintuitively, the healing phase has many more symptoms, and it's actually quite complex with these two phases, with these two sub-phases, and a healing crisis in the middle. So it starts when we resolve a shock or a conflict. The nervous system flips into parasympathetic mode, so rest and restoration, and we have new general symptoms. So in part A, we have warmth, sometimes fevers, increased appetite, a lot of fatigue, and you can imagine why this is. So you can imagine in the active phase, everything's tense, everything's stressed, not sleeping very well, not absorbing food very well, and tight. And then you let go, you're relaxing into healing phase, and you're exhausted from having been in this stress for, if it's been a long time. So the body needs a lot of rest when we heal. There's also water retention, because we need water to repair tissues that have been damaged in the active phase. Sometimes there are infections. We'll talk about that in the fourth law. So when enough healing has occurred, the body has a temporary relapse into the active phase, and that's called the Epileptoid Crisis. This was recognized as the healing crisis in homeopathic medicine, and it's a short burst of sympathetic nervous system, and what that does, it presses out the water that's been accumulating to help heal. And in the second part B of healing, the water's being expelled. It's sometimes called the PP phase, and the energy gradually comes back to normal. The specific symptoms will be unique to the shock. So for the kinds of cancers that we've been looking at, for instance, the colon cancer will grow in the active phase. We won't really notice it. But when there's a resolution, that colon cancer will start to be degraded. And then that is when it starts to bleed. So often that's when we discover that we have colon cancer. And really at that point, if one understands German medicine, we don't really need treatment. And I've actually had a case of that where somebody came with colon cancer and she was just told, okay, you need some more chemo. And when I learned the history, I said, you can stop. You have to learn this, but if it makes sense to you, you can stop your treatment. So it made total sense to her because she was actually feeling quite well. She had resolved the shock, so she wasn't in a huge stress phase. And so she stopped her treatment and then contacted me a few months later saying she's all clear, no more cancer. So the body does that itself as long as we understand how to work with the body. Let's see here. So this is the warm phase. The brain also goes through both phases. So in the active phase, the brain lesion where the shock first hits are these clear target rings. In the healing phase A, that target ring, which is actually a loss of cells, not nerve cells, but glial cells. The glial cells in the brain are like packing. They pack around the nerve cells. And they're the ones that are affected. The glial cell loss is what causes the target rings. So in the healing phase A, the target rings also absorb water so that they start to look fuzzy and the glial cells start to regrow. If there's a brain scan at this point, this will be diagnosed as a brain tumor, but often it's not even noticed. And sometimes they're just found on autopsies. In the healing phase B, the glia integrate back into normal tissue, and where you once had what looked like, or what we interpret as a cancer, it becomes normal. There's just a small mark where the ring was, if there's a total resolution, if the person goes through the whole program. So, let's see what I'm here. So here are some examples of some brain healing pictures. So we can see that they're round, just like the rings were round. And these are the rings in healing form. And when they finish healing, you might have just a little mark like this, where that once was. So it's very astonishing, very startling. And it explains why when Mickey was diagnosed with brain tumors and we put him to bed and only did naturopathic treatments and all his symptoms stopped, he was actually done. He didn't need any more treatments after that. It was the treatment, having the brain surgery, that actually caused the relapse of the symptoms, not a cancer. Again, hugely counterintuitive and a huge new way of looking at things. So now we come to the most startling law for me, because it actually goes into much more detail about what to expect when a shock happens, depending on which part of the brain the shock hits. So Dr. Hammer noticed that when shocks hit the old brain, which is more the back of the brain, more the survival, the oldest evolutionary part of our brain was hit, that tissues would grow. So for instance, the lung cancer, the colon cancer that we've been talking about, those are all old brain related. And they stop growing when there's a resolution. That's the old brain pattern. But there's also a totally opposite pattern that happens when shocks hit our new brain, which is more the frontal lobe and the other parts that are new evolutionarily. And it's what happens in the shock phase is that a certain tissue will actually ulcerate, lose cells. And in the healing phase, those cells will repair. And if the active phase has been intense and long, the repair will create a lump of some size. So the more intense the active phase, the bigger the healing lump. There's another pattern which we're not going to use or go into today, another pattern that relates to new brain, which is a functional loss. So this could be a diabetes where the pancreas loses function, or it can be like an MS, a paralysis, where the arm can lose function. And in the healing phase, that function returns. So the diabetes goes away, or the limb, the paralysis heals. So some examples, I've already told you some, the lung and the colon cancers as examples. So I'd like to tell you a story of a case with bile duct cancer, because it shows another point that we don't have to have faith in this for it to work. This is how our bodies work naturally. So an older woman came in with diagnosed with bile duct cancer, had no interest in doing German new medicine. She was brought in by her son, dragged in, sat there with her arms in front of her chest, saying, "I'm having surgery next month, and I'm just here because of him." So I said, "That's fine." I said to her, bile duct cancer is bile duct cancer is specifically related to the issue of a territorial anger. So the territory can be one's home, one's profession. And she kind of perked up and she said, "Well, that actually did happen to me in my profession. Somebody claimed a project that I did as theirs." And I then said to her, "But the bile duct cancers always grow only in resolution." And she kind of did a double take again. And she said, "You're right. It was resolved. It all is fine now. The truth was out, but I'm still doing my surgery." So I said, "That's fine. You can't ever, this German new medicine does not work. Well, you'll see sometimes it does, but generally people have to want to do it. But in this case, I gave her some homeopathic remedies, didn't expect to see her again. And she was back a few months later. I said, "Well, what are you doing here?" And she said, "Well, I have to tell you the story of what happened. I went for my surgery the following month and I got bumped." Okay. Went the following month and got bumped again. So finally, she was ready to have her surgery and they did a scan and there was no lump. So she said, "I had to tell you. It was exactly what you had said, and that's what happened." And she did not believe it. So this is not something like where you have to do an affirmation or visualize or do anything other than realize that the body's going to do it itself. So this is also the case or the situation where it's not as crucial for people to need to be able to do emotional work. When they come with cancers that are healing cancers, the issue has already been resolved and the cancer will stop by itself. So for me, that's been the most amazing law in German medicine. I've seen it over and over and over again with just as much amazement now as when I started learning this in 2002. So here's the graph for Law 3. So we're going to add some more things into it. So we have the two phases, but if it's an old brain tissue or organ, you're going to get cell growth, so cell augmentation. And in the healing phase, you're going to get the tumor. It's either going to degrade with microorganisms, which we'll talk about in Law 4, or it will encapsulate and be stable, as with the woman with the lung cancer. And in the new brain, you have cell loss or necrosis. And when we go into healing, you have that cell rebuilding, and in some cases it will make a lump, but that lump again will either stop on its own and stay there, or it will again be degraded. So, example. So I used breast cancer as an example for Law 3 because there are two kinds of breast cancers and they're actually opposite. One is mediated by the old brain, and the other type of breast cancer is related to the new brain, and they have opposite patterns. So that's why it's very important to know what kind of tissue you're dealing with. It can't just be the organ, because most organs have different kinds of tissues in them, and they can be related to different parts of the brain. So the gland in the breast responds to extreme extended worry for a close person. And again, you can see how that's a primitive reaction by the body. It's trying to nourish somebody. So maybe, a million years ago, we actually produced breast milk. Now we don't anymore. We open the fridge and get milk. So our body has lost the actual function of producing the milk, but it still has that knee-jerk reaction of growing the gland. So handedness applies here. So in other words, the side in which you find a glandular breast cancer will indicate the type of relationship, and it will stop growing when the worry is over. So the case example that I have is a middle-aged woman who had had a breast lump for quite a few years, and it grew and receded. And then recently she had it biopsied, and to her shock, it was actually breast cancer. And she came to me because she already knew German New Medicine and she wanted some coaching. So when we looked back at the history of when that lump grew, it correlated with her son doing risky activities and that huge worry that she had that he was going to die. Doing these risky, I think it was car racing or something like that. And so to resolve this, she had to learn to not worry about her son, to accept him as he was. And how we helped her do that was by clarifying that when we worry about a close person, we're actually bombarding them with negative energy. There's a very terrible research that was done with cats. And they took a mother cat in England. They took the babies away from a mother cat in England and took them to Australia. And they hooked the mother cat up with electrodes. And then they started to kill the baby cats. I'm sorry to say this, but let's learn from it. We'll honor their lives. Every time a baby cat was killed halfway around the world, the mother cat's electrodes went crazy. So we're so connected with people that we're close to. So if we're worrying about them, we're bombarding them with something that creates stress. So that made a lot of sense to her, and she was very motivated also for her own sake that she would have to resolve this in order for this breast lump to stop growing, because now it was serious, it was diagnosed. And so she learned some techniques and learned to take a new perspective of acceptance. And that lump stopped growing and it never grew again. Every time we touched base with her, it was very small. And even if the son did risky activities, it didn't grow again. So if we look at the other type of breast cancer, it's the more common kind. It's related to separation shocks. What happens is that it's the breast ducts in this case. So they're the tubes that go from the gland out to the nipple. They take the milk out to the nipple. And so the German New Medicine theory is that when the ducts ulcerate, they widen, allowing the milk that's not needed anymore to leave the breast and not congest it. And what happens when there's a resolution, those ducts regrow, and if it's been an intense shock and long, there'll be a lump. So an example that I had is somebody came with a ductal cancer, a ductal lump in her dominant side. And going back into her history, she had suddenly separated with her partner. It was a very shocking separation. And so once she saw the timing that was so perfect, that she had gotten over that separation, and that's when the lump started to grow, that she didn't do any other treatment except for basic health. And then in 3 months, that lump was gone. It stopped on its own. Now, I want to be really clear that, of course, I'm telling stories. I'm telling my teaching cases. And it's not always this easy. That's why I wanted to be really emphatic about, if you're going to use this for yourself, please, consult with a practitioner. Okay, I want to talk about kidney collecting tubule syndrome. And this is probably one of the most important concepts in German new medicine for treating anything. And it's not one of the laws, but it relates to Law 3. And what it is, it's two programs running together. A kidney tubule program, and I'll tell you what that is in a moment, plus in active, plus another program in healing. And so you can be going along healing, let's say the lungs, and the kidney tubules kick in and all hell breaks loose. And that's what I'm going to describe now. So the kidney tubules are activated by three kinds of shocks: abandonment, refugee, so one is separated from one's tribe, also a kind of abandonment, and existence conflict. And the existence conflict is when we're not ready to die. And we get this shock of, oh my gosh, I can't leave my child. I can't leave my husband. He won't be able to take care of himself. I can't leave my work. I still have work to do. That's an existence shock. And so when we get those types of shocks, the kidney shuts down the collecting tubules to retain water. And the old primitive explanation for that is that retaining water allows us more time to find our tribe again, to survive. We need water to survive. So it's like when we're fish thrown out onto the beach by a wave, then the kidney tubule program would kick in. We would be hydrated until the next wave came to get us, because we still have all of those programs from a one-celled organ right up through to humans. When we're an embryo, we actually have gills at some point, and then we lose them. So we have all these programs, these animal programs, which we don't really relate to. We don't understand them. And it's through Dr. Hammer that we now see that we have these primitive programs going on that are trying to help us. So when we have a kidney tubule program in active and we have this water retention, remember that when we talked about healing, there's also water retention in a specific place where a shock was manifesting, because the water is needed to repair the stress damage. So when we retain water through the kidney tubules, it also goes to where we're healing, and it causes more swelling and pain. And if then we get more frightened because of those symptoms, the kidney can actually go into kidney failure, and we can die of that. And it's very interesting that, again, before I knew German new medicine, I was reading a book on nutrition and cancer and came across a research piece, which I was looking for and I couldn't find the connection, but that said that 70% of cancer patients die of kidney failure. So people are actually dying of fright, not the cancer. So I wanted to and also, there's swelling in the brain also. So you're going to get headaches and things like that as well, because the brain is also healing when there's a part of the body that's healing. That target ring is going to be growing glial cells back. So an example of this is one of my patients who had lung cancer, fear of death. She'd gotten over it. She was healing. She had no more coughing, no more shortness of breath, but she needed to go to the hospital for something else. And at the hospital, they asked her about her cancer, and she said, "Oh, I'm working with a naturopath, and she says that this can heal." And of course, there was a huge reaction to that. And they said, oh, she's just trying to take your money and you better be prepared. Have you got your will? You're going to die. And even though I try to make teams for families, for patients, nobody could go to the hospital with her. So she was alone. And when I said fear is contagious, she took on that fear and she called me, and I could hear that her lungs had taken on water, and I could hear the water coming up through her mouth. She could barely talk. And that was the kidneys shutting down and the water being retained in the lungs, which were healing. And so I said to her, no, you're going to be fine. This is what's happening. You've been frightened, your kidneys have shut down, you're retaining water, and I'm going to send somebody in to hold your hand. So I called the team, explained what was going on, said there's not a danger, just go hold her hand, reassure her. And the next morning I got a call from her. Hi, sweetie, totally clear voice. Water had all receded. So I went to visit her in the hospital, and the nurse took me aside and said, what did you do? We never see people recover once that water starts to happen, once the kidneys start to fail. What did you do? So you can see that they're quite aware of this pattern, but we don't know enough about it. But we've actually pulled people back from this death several times through simple reassurance and information. And now what we do is we tell people ahead of time that this could happen. So I've got another story where we have a person with a breast tumor, which is stable, and she's gone back to her work. And I've warned her that if the kidney tubule syndrome kicks in, that this tumor will swell, and that it's not a cancer growth, it's not a cell division. And so she's fine. And 6 months later, I get this emergency call saying, oh my God, my tumor has doubled overnight. And so I asked, did something frighten you yesterday? Remember about the kidney? And she, oh my goodness, I talked to my mother and she was so frightened that I was going to die because I wasn't doing the treatment. And she, you could noticeably feel her shoulders go down over the phone. And she peed it all out, and next day the lump was back to its normal stable size again. So you can see there are all these little pieces in German new medicine that you have to know and be aware of and be on top of in order to use this successfully. Let's see. Okay, let's go into Law 4. So with Law 4, Dr. Hammer noticed that only in the healing phase were there infections. That when we're in the active phase, that increased cortisol actually protects us from having infections. And even more interesting, he said that these microorganisms were helping us heal, evolved with us, and they evolved with us in sync with our brain. So the oldest organisms, being fungi and TB, are active and help us heal from old brain conditions. Midbrain is bacteria and new brain is viruses. So let's see if I have examples here. Oops. Come on. So an example would be somebody with a glandular breast cancer, so not ductal, but glandular, so the worry program. And when there's a resolution, and if the woman has TB bacteria, not everybody does anymore, that TB bacteria will degrade that lump and get rid of it because it's no longer needed. The bacteria will actually help us regrow tissues that need to repair. And the viruses have often been found related to cancers, but they don't cause the cancer, as modern medicine thinks. They're actually part of the healing. And I've put in a little plug here about exosomes. because they are a small particle that's produced by cells in response to stress and toxins, and they look exactly like viruses. And Dr. Hammer often said, I don't think there are such things as viruses. So it could be that we're finding out that this is true, including with COVID. But if you want to know more about COVID, you can look at various websites, which I will give you at the end. So law 4, let's see here. So law 4 is when there's a DHS, the body will actually, if it has the proper microorganisms, will start increasing them in the active phase. And so that's when somebody, for instance, is a TB carrier, but they're not active. And then when there's a healing phase of the old brain, the TB bacteria will be active here in helping heal, in helping degrade a tissue that's no longer needed, a tumor. And it's similar for the other levels. This isn't something that I use that much for cancer, to be honest. So with law 5, it's kind of the overall picture of medicine that's now totally changed according to German New Medicine. It's almost like the earth is round and not flat for medicine. So what we think of as diseases are actually special programs of nature designed to help the individual or the species. And when we get through a healing phase, we're generally stronger, more aware, and more resilient. And the significance of this law is that we can learn to trust our bodies and allow them to heal with a minimum of intervention, saving time, energy, and money. For example, our little clinic alone saved our provincial health insurance over $2 million in cancer treatments that were no longer necessary, with people outliving their prognosis for years and sometimes decades. And so once German New Medicine is integrated into mainstream and alternative medicine, then we'll move forward into a whole new age of treating almost everything, with the limiting factor being more the one we already know, which is poverty. It's actually the factor that corresponds most to people healing or not, is whether they can afford their treatments, which is a bit sad. But you can see from how we've gone through the laws that what a future this could bring. Dr. Hammer also reframed metastases. So metastasis is the medical term for the spread of cancer from one organ to another. It's actually never been proven. And Dr. Hammer said, if cancer cells did move around, they wouldn't be able to grow in a different organ or tissue. It's hard enough to grow them when we're in the same tissue, like with bone marrow transplants. And the new cancers that often come when we have one, we sometimes do get other cancers, are related to new shocks. So lymph nodes relate to self-devaluation, moderate self-devaluation. Bone is a deep self-devaluation. Liver is a starvation conflict, feeling afraid that we're going to not make it. Maybe we've watched somebody die with the cachexia and we're afraid of it. The brain, so-called tumor, is actually the healing phase of any conflict. So this is a very important concept to go over with people, because it's one of the deepest fears of cancer patients, that they're going to get it somewhere else. So if people really can understand this, then they can drop that fear. So a fifth law example would be ovarian cancer. And the ovary is governed by the new brain. It responds to the death loss of someone close. In the active phase, it ulcerates. In the healing phase, it repairs. And if it's been intense, it will grow a tumor, which stops growing in 9 months because the ovary is integrated into the pregnancy cycle. And it provides When it stops in 9 months, this tumor becomes an active part of the ovary, and it provides more hormones to either conceive another child, if we've lost a child, or if we've lost a partner. All those hormones make us more attractive, and we have a better chance of attracting a new partner. And we have had a poster child for German New Medicine. One of my first GNM patients came. She came every once in a while to see me, but mostly was pretty self-directed and pretty healthy. And she came all of a sudden with this ovarian cancer diagnosis, being told that if she didn't do the treatment, that it would kill her in 3 months. And so I was very excited, and I said, "Whoa, I've just learned this new stuff." And she immediately realized that it fit her pattern, that she'd lost somebody. She had just recovered from that loss. And then we mapped out how long 9 months would be from when it started. And we started measuring her tumor. It actually got very big because the stress had been very long and deep. And at 9 months, we just kept measuring it, and it kept being the same. And then she had it out a couple of months later without taking anything else out. She found a surgeon who would only take out that lump. And when the pathology report came back, it said tumor was already dissolving. So, and there's a very poor track record for ovarian cancer in the medical system. 1 out of 3 is what I've heard. And we have 6 out of 7 ovarian cancer. We call them cures. So that's an example of the 5th law of the body helping us with a shock. It's not a disease. Okay, using German New Medicine in general, review screening points. So basically, make sure you're a good candidate first. And if some of those pieces are missing, then try to fill them in. Then study the basics. Make sure German New Medicine makes sense to you. I've put a picture of my book here because that's why I wrote it, to try to help people understand it quickly. Then for conditions, you have to assess the type of shock. And if it's active, you have to resolve something. If it's in healing, you have to ride out the symptoms. And then you cultivate a process of self-awareness. So now we're going to go a little bit deeper into these steps. So step 1, you want to identify the organ or tissue. And I think you've got a sense of how important this is, because 2 different parts of one organ can have totally different patterns. So in some cases, you need a biopsy. No, there. Step 2, identify the shock and locate it in your life. So let's say you have a ductal breast cancer. It means you've healed from a separation. So when did that happen? Here I have the example of a prostate cancer, an ugly genital conflict. Often it's a rejection, a sexual rejection, and the prostate's growing to help a man have better sperm. And so then we're looking for that conflict, and it's very, very therapeutic when people can clearly see their conflict, because then it makes sense for them individually, not only in theory. Step 3, you have to determine which phase you're in, active or healing, because then you know what to do, whether you have to resolve something or what kind of symptoms you're going to be meeting. So I mentioned that there's an epi crisis. So for some conditions, you're going to have maybe a seizure. With many of the cancers, you won't notice your epi crisis, except you might be stressed for a day. Step 3A, active phase strategies. So you need to resolve a conflict, but more than that, you need to identify situations, people, and environments that re-trigger the conflict. Because everything that surrounds us when we have a shock becomes part of an alarm system for the brain. So for instance, if we're eating cauliflower soup and we get a phone call and somebody's died, cauliflower soup could be then a trigger for us to put us back into the shock. It could be time of year, it can be a certain building, it can be certain people, foods, smells, the phone. So we have to take that apart, and really good German New Medicine practitioners are excellent at this. So you also want to downgrade the conflict with self-talk. Just say, no, it's not so bad. It's okay. Where's the lining? In the case of leukemia, the active phase is when the cells are low in number. And sometimes you'll need medical intervention. And that's when you have blockages. So sometimes the body's trying to help you with something, but it's growing too big and it'll block something. So sometimes you might need a surgery as part of, integrating with German New Medicine. That's why you don't want to burn your bridges with your medical team. B, in the healing phase strategy. So to learn that with respect to cancers, these cancers stop on their own if they're not re-triggered. So you want to learn that you may have fevers, and that fevers in this case are wonderful. There was a research project done by an oncologist in New York City around the early 1900s who didn't understand why he'd lose some people and not others, and he couldn't predict it very well. So he drilled down and did more observation and noticed that people with fevers tend to survive their cancers. And so this is something that's been noticed in homeopathy for hundreds of years. And of course, this has been lost. And these days, if you're undergoing medical treatment, if you have a fever, it's immediately suppressed. So it's immediately decreasing the body's ability to heal. And just as a note, in leukemia, in the healing phase is when the cells rise in number. And so you let them rise and they come back down by themselves. But I've 3-starred the fatigue. I've really noticed, especially if people have more than one cancer that they're healing with, that the fatigue can be enormous. People are actually in bed and can't move. And so they need people around them to take care of them and to keep reassuring them, because it's totally frightening to be that tired. It's a new concept that fatigue is part of healing. So even when I get really tired, I often forget that I might have just resolved something. My first thing is, oh my God, I'm not strong. So we always have to that's why it's good to have German New Medicine communities. Step 4, find tools for processing. So you want to process fear, especially. Oh, fear was under my picture. So fear can lead to the kidney collecting tubule syndrome, where the water accumulates, causing more pain and swelling, and even death. And so we tell people, when you get afraid, talk. It's one of the things Dr. Hammer would say. Talk, talk, talk. Talk it out. We use tapping. We use EMDR. We use homeopathic remedies. We use Reiki. And this can be the most important part of a treatment, is GNM, for obvious reasons from what I mentioned before. Step 5 is cultivate a healthy lifestyle. So even though German New Medicine teaches that poor lifestyle habits don't cause cancer, they definitely predispose us to being less resilient, so that when we get a shock, if we're not feeling strong, they're more likely to take hold. If we're feeling really strong, we can throw them off. So an example of that is my mother. My mother, in her late 50s, went to Germany. I come from a German family, and went to the cancer clinics there because both her parents and all 4 of her grandparents had died of cancer. So she wasn't going to. And she came back with such a clean bill of health. They said, you will never get cancer. 2 years later, she has inflammatory breast cancer, ductal. So it's a healing phase, but she still got it because she had a shock of a separation with my dad. And she was healing that. She had a new partner. So it was a healing phase cancer. But of course, at that time, 20 years ago, we didn't know about German new medicine. So we did all kinds of naturopathic things, which were as bad as chemo. The diet was too extreme, made her too thin, and we didn't know. So we lost her, but she was extraordinarily healthy. So it's an interesting thing. So sleep and rest is probably the most important lifestyle habit to cultivate when you're healing. Exercise needs to be gentler for a lot of people. You can't overdo it. It takes energy away from healing. Meditation is a wonderful lifestyle habit, helps our brain rest and recharge, stabilizes mood, and social contact is one of the most important factors in all the research of healing, is that people have a good social network and they just like to be alive because they love all the people around them. So diet in line with German new medicine. Don't fast or detoxify during the healing phase unless you have a very strong body. So I usually do various testing, physical testing, to see whether a person is ready to detoxify or not. And be careful about too many greens or supplements that push the body into detox, because the body is usually depleted after prolonged stress and we need to do building. And sometimes even a vegan diet is not indicated. It's best to, if you can get your head around it, use animal products and honor the animals as part of your healing, because it's a time-honored thing to have meat stews to rebuild the body. The body recognizes those amino acid sequences and puts them directly into our tissues. So I know that will offend some people, and I totally sympathize with that, because I also don't like killing animals, but it's where I only buy organic meat and recommend that to people if they can afford it. Some people can't. So again, it's very individual. Step 6, monitor your progress. Don't say, oh, okay, we've got a healing tumor and I don't have to do anything anymore. Stay with it. Keep track of your symptoms. I get people to measure things and take their weight, especially because I have a few people that I work with over the phone. I say, tell me your weight, because if they start losing weight, I know they're in active phase for something and we need to resolve something, and we resolve it and their weight starts coming back up again. So, and 7, moving forward in one's life. So we have to, our life, like our diet, we have to like our diet if we're going to stay with it. If we want to stay in our life, we have to like our life. So I encourage people, go back to work, develop new hobbies, spiritual practice, travel, relationships, projects. But most importantly, keep studying German new medicine. And I'm going to, in the resources, recommend several ways to do that. And remember about other healing symptoms that occur along the way. And I'm going to tell you a story about a woman who came to me with ovarian cancer that had already been treated medically. So she'd had surgery, everything out, chemotherapy and radiation. And she just wanted to prevent a recurrence. So I taught her German new medicine. And as part of German new medicine, I told her that the big trick with ovarian cancer is that when we feel safe, that part of that healing will be a lymph swelling. And in regular medicine, that's seen as a recurrence or a metastasis. Even if there are no cells, they theorize that there was a few cells left and they spread. But we don't look at it that way. So I alerted her to that she might have this lymph swelling once she feels like she's safe. And she did very well. And 2 years we worked, and then I get a phone call. I said, oh, I was just in the hospital, and it was just like you said, and the lymph swelled, but it blocked the colon a while, so I had to be on IV, and she was in the hospital reading magazines, happily with the IV, knowing that she was at the epitome of her healing, and her doctors all said she had to have treatment because the ovarian cancer had come back. But funnily enough, after a week, all the swelling was gone. And they released her saying, well, you have a clean bill of health. And she had this image of all the doctors and the students standing around with their clipboards looking at her in total puzzlement. And I said, well, you didn't even call me. She said, I know, you had told me exactly. It was exactly as you had predicted. And then I went to Europe and had a celebration in Paris. And then when I saw her finally, she looked 5 years younger. So you can see how this is so opposite. And so once you think that you're fine, don't stop. Don't stop studying. Don't stop thinking about how this works in your life. Use it for even the little things in your life, because otherwise it could take you by surprise. Now, with integrating German medicine with other treatments, we're only at the very beginning of this. So, I mean, optimally, we would all work together. So medical doctors open, learns about German new medicine, and we work together. Unfortunately, this doesn't happen yet. And so it's sometimes messy. We do the best we can. We try to not burn bridges, and we try to, when we do want to postpone or modify a treatment, to couch it in language that builds a bridge to the medical people. So I'm not ready for my treatment. I don't feel strong enough. You don't go to your medical doctor and say, this is a healing tumor, it's going to go away by itself. It won't work. We want to stay on board with them in case we need them. So we want to, unless they're very open-minded, we probably need to use a different reason for postponing or modifying the treatments. And this is kind of painful for me to say because I don't like doing that, but excuse me. In the alternative mode, it's the same, because most alternative practitioners work with the old paradigm of cancer. It's a disease, it'll grow until it kills us, and we need to do very extreme diets and 1 million supplements to treat it, and lots of cleansing. So it's tricky. So basically, those of us in German new medicine are actively trying to teach, to build these bridges, and to create teams where we can all work together. So in one of my cases, we're a team where it's myself, an emotional healing coach, a homeopath, and an energy worker. And we all have equal parts in this. We meet regularly, we share information, and this woman feels totally held by the 4 of us. We all work together, and it's so beautiful. I mean, I can just say to any of you who are practitioners, it's, you can see the future, and it is wonderful. So resources. So I've added a few more. Usually I've been studying with Ilse-Dora Laker for 18 years, and I consider her probably the top technical expert, and as well as intuitive. She's, excuse me, brilliant and probably one of the top in the world. I also have recently started working with Andy Locke-Mears, who is a lovely teacher and practitioner. I'm actually redoing a practitioner course with her, with a group of people who are creating a German medicine study group. This is still open if anybody wants to join us, because we're only starting in a week and a half. Carolina Markelin was one of my teachers, a very clear theoretical teacher. And she has a website with a lot of information on it. And then USA GNM is, again, a source of more practitioners. Sorry, I should drink something. Got a frog in my throat. And you can sign up on our website, ecowellness.com, if you're interested in getting our newsletter. If you're interested in working with me, we have a screening form, and also an assessment afterwards to make sure that there's a good fit. Sorry. Other resources, I use Ayurvedic medicine. I very much recommend that people create, I call it a home base, a lifestyle home base based on their Ayurvedic type, also their blood type. Dr. Mercola, Dr. Weil, Eat Right for Your Type. These are some resources that I use. If your state or province is registered for naturopaths, there'll be an organization that you can call and you can screen. I always recommend that, call people, make sure it's a good match for you. It's very important that you like your practitioner, that you trust them. Okay, we're over to you, Rebecca.
Great, I'll just go off of mute then. Thank you so much, Catherine. So we don't have a whole lot of questions on the chat window, but we will go through the ones that we've got. So the first one was actually for me, and that was, you showed us the brain CAT scans, and so the question I had is, do you actually have to have that CAT scan in order to be able to understand and know what the situation is with German New Medicine?
You always show me what I forgot to include. I love that about you. Thank you. So no, you don't, because there's a total connection, which is, what's the word I'm looking for? Which is carved in stone. If you have a certain disease, so-called disease, a certain program, we can call it, that's always related to a specific shock in a specific part of the brain. So we know where that lesion is going to be when we have a correct diagnosis, when we have a biopsy, when we know which tissue we're looking at. So very, very rarely do we need them anymore. At the beginning, we did a lot of CAT scans, but not so much anymore.
Okay, so you don't really need it, but if you have it, then that just gives you more information about it. Is that right?
Yep.
Okay. Great, thanks. The next one is from Julie, and the question was, what time lag is there between when the shock happens and when the manifestation of the cancer occurs?
Typically, if you see, this will vary depending if the conflict is steady or if it's up and down. So for instance, that woman with the breast cancer was worried about her son. It came and went. So, but if it's a steady shock, let's say the child is in intensive care and you're just in constant shock and it's months, it's usually about, I would say, 3 months. The healthier you are, the sooner you're going to see the shock because your body's stronger and able to grow these cells faster and better. It's, again, counterintuitive. So when people tell us, oh, you have an aggressive cancer, I go, yay, this person is vital.
Julie, does that answer your question?
Yes, it does. Thank you.
Great.
Great. Okay, Diane was wondering if you could expand on the GNM study group that you just mentioned.
Yes. So basically, it's going to be focused around taking the Practitioner Course with Andy Locke-Mears and working together. So then we'll be on the teleconferences together, and then we'll help each other. And what I'm trying to develop is a group of people so that as I get busier, that I'll also have other practitioners to work with. So I think it costs about $1,300. She's given us a discount, and there are 2 parts. There's a first part, which is about $300, I think, US. which is the basic German New Medicine course. Very, very well done. And I would recommend it to any of my patients who are wanting to work with German New Medicine, because once you take that basic course, you have access to Andy on her weekly hour teleconference for life, which is worth gold, and you're part of a whole community. And I think that's just so wonderful. And then the second part is the actual practitioner course. And I haven't started that yet, but a lot of it's online videos, and Andy is very good at explaining things. And it'll also involve doing a case report. I think the whole thing goes over 5 months, and it's a weekly half hour with just our group, mostly our group and Andy, clarifying what we've been studying. But I also will make myself available to answer questions and talk with people, and we can have our own Facebook, and we can develop our own ways of how do we want to keep developing this in our lives. You know, we have somebody in the practitioner group who's an optometrist, for instance. So she will specialize in the very complex German medicine knowledge about eyes. And so people can become specialists within German New Medicine. We need that because each part has such deep knowledge. It's very exciting. So if you are interested in joining, contact me through our website. Leave an email with Ellie, our manager, and she'll forward you to me, and then we'll talk directly if you're interested.
Right. So the email to send it to would just be to the
info@wellness.
Right. Okay, got it.
Yeah. It'd be great to have more people join us.
So Diane, does that answer everything that you need to know about it?
Actually, I had one more question related to it.
Mm-hmm.
So you said you have the study group starting in about a week and a half.
Yeah.
Correct? Okay. Yep. Do you have a course or a study group starting every 6 months or something? Because it sounds like it's a 5 or 6 month course. Or is it just, go ahead, please. Thank you.
No. Good question. No. If you want to join later, you absolutely can join later. And you can take it with Andy. You'll be taking it with another group, but then you can come back and join our group.
So your vision, Catherine, is then to have a community of people in this area that can get together and support each other and learn it together.
Yeah, and it doesn't even have to be just this area, because of course we can communicate by Zoom. And now a lot of German New Medicine practitioners are working online. So if I want to have help, if I want to refer to another practitioner to do, with a certain patient, then that can also be online. So it doesn't have to be in Ottawa. It can be anywhere really. But it's nice also we'll be able to get together. So maybe if somebody's from afar, they can, once COVID is over, come and visit, and we can maybe, create conferences and that kind of thing. We could create our own summit, for instance. Or I was also thinking we could develop Canada GNM. And yeah, I'm pretty excited about all of that. Anybody's welcome to come play. It's open.
Thank you.
Mm-hmm.
The next question I have is from Julie again, and she's just asking, can you help someone with just about any condition using German New Medicine?
That's a very good question. And I go into that a lot with the introduction and the other webinars I've done, to clarify that German New Medicine is for conditions that are related to shocks, but there are lots of other ways that we can get sick. Toxicity, we can be poisoned, we can have accidents, we can have nutritional deficiencies. So there are other ways. So one of the things that I do, and it's very nice being a naturopath and practicing German New Medicine. I love doing it together, because through naturopathy, I have all kinds of other mechanisms that can make people ill, which I screen for and make sure that this is actually a German New Medicine issue and not from another cause.
Right. So not every condition is German New Medicine is the final answer. Does that answer it for you, Julie?
Yes, thank you.
Great. The next one was from Micah, and she's asking, can you use German New Medicine for prevention since we've all had shocks in our life?
Yes. Great.
Heal the shocks before the cancer shows up.
Yes, you can. And basically, that's cultivating a healing practice for oneself. And that's self-reflection. So getting to know oneself and healing one's issues bit by bit. So developing healing practices, so meditation, maybe therapy for some people if one has had a traumatic childhood, to gradually notice, how do I carry my shocks? What do I say to myself? How do I respond? Because we can also have mental conditions that are caused by shocks. And I didn't go into that today. It's a whole other topic. But you have two shocks in the same brain level that can constellate us into mental illness. So to learn about all of that and notice, it's dry in here. To notice how we respond to things and gradually learn. I think the ultimate really is to have a spiritual practice where one learns to cultivate an understanding and a surrender to our higher self, however one understands that.
So does that answer your question, Micah?
Hopefully.
She typed yes, so that's good.
Glad.
And she says thank you.
You're welcome.
Okay, the next one is Surya. Do you want to go off of mute? Because she would like to ask a question about a conflict.
Yeah, great. Mm-hmm. Go ahead and unmute yourself, Surya. I can't hear you yet. I still can't hear you. Might want to try typing it after all. I'm not sure what happened there.
You have, okay, she's typing.
Okay.
Okay, well, she said, can you please tell me the conflict related to the number of tumors I have? A 3.6 centimeter gastrointestinal stromal tumor and 2 nodules, right thyroid, mid-pole 2 centimeters and upper pole 1 centimeter. Tests in August 2019 were all normal. March 2020 had ultrasound, then CAT scan. I've lost 25 pounds since April 2020. I've been losing weight down to 85 pounds. I just recently gained a few pounds in the last month. And she said she's sorry her mute button wasn't working.
Okay, so if I understand it, there was a thyroid and a gastrointestinal. I thought there were 3. What was the third one, Rebecca?
Okay, 3.6 centimeter gastrointestinal.
Yeah.
All right, I just got my.
Okay. Well,
nodule, right thyroid, upper pole.
Right.
2 on thyroid, 1 on stomach.
Okay, thank you. So stomach, I would have to know there are two parts of the stomach. So I'd have to actually know the biopsy. So I would know the cell type. So one part of the stomach is territorial anger. The other one is?
It's close to the pancreas tail.
Oh, yeah. I'd have to research that. Sometimes I don't have them on the top of my head. Gastrointestinal tends to be what we call a morsel conflict, and it's often related to anger. Thyroid, there are also 2 parts of the thyroid. So it depends if it's the duct or the gland. Is that right? It's usually the gland. And the thyroid gland is related to, again, what German New Medicine calls a morsel issue. And it's trying to get or get rid of a morsel. And so the thyroid builds the gland in order to increase the metabolism so we're better at getting a morsel or getting rid of something. And so the example might be you're trying to buy a house and you're in big competition, or you have to sell a house, or it's just anything that you're trying to get, and you have to be more active in order to get it. So talking about these theoretically, sometimes they don't make so much sense. You have to kind of look at somebody's life and the kinds of traumas and stresses that they've had, and to see where it fits. I feel like I'm maybe not being that helpful to you. Sorry.
Right. So it's too bad Surya can't go off of mute, because it's easier if she could talk. So Surya, is that helpful to you, or is there something you'd like to clarify with this? Maybe you could type something else to us.
I have had good success with thyroid cancer without any treatment, and also with digestive cancers. We had somebody with stomach cancer who came for a weekend and then didn't need his treatment anymore.
Yeah, she did. She typed that we lost our house last August.
Oh my goodness.
And she just lost her dad this August.
Yeah, losing your dad, that would be more of an ovarian issue, you know, like a death loss. It hits the ovaries, the reproductive, unless there was another issue involved with losing your dad other than grief. Like sometimes if there can be an inheritance issue, that can often hit the pancreas.
He was abusive.
Well, so that might be related to, I'm not sure how that would fit. I would have to know more. I'm really sorry. I would put this together if I could. It's not coming to me clearly.
Right. She said she was living at home, but she was not able to move out because of finances.
So you can imagine that would create a lot of anger.
Yeah.
Yeah.
She said it's okay. She appreciates this, and she knows it's complicated. So
sometimes it is, and sometimes it's very simple. But
yeah, it's been interesting. I think it is, at least from my perspective, and I think for all of us, that to sort of be hearing about this a specific case and to see how it is you're looking at it and what the traumas are and how they're related to different pieces.
Yes. Well, and that's what's taught me all these years. I mean, my patients have been teaching me how this works. I've been very, very lucky to have so many intuitive and brave patients.
Yeah, amazing.
Mm-hmm.
There was a couple other comments that are just thank yous to you.
You're welcome. My pleasure.
Marie Sylvie had said, I'm a good example of healing with German New Medicine. And yeah, another thank you from Karina. And thank you from Wendy. Diane said that Dan had a question.
Oh, good.
Sorry, I missed that, Dan. You want to go ahead and go off mute and ask your question, Dan? Oh, there it is. I see it. I missed it. With the pandemic, many people are isolated from loved ones. They are less active, more afraid. Can you comment on this from a GNM DHS perspective?
Yeah. So basically, the originating shock for a COVID type picture would be a territorial fear that's resolving. But then when people get sorry, my brain's getting tired here, get pneumonia, that's often the kidney tubule syndrome. So that's the abandonment, that's the existence fear, that's the refugee. You can imagine you have refugee conflict, you're in the hospital, you can't see your family. And that would, of course, escalate these lung syndromes and cause very quick deaths with the pneumonia in some cases.
Dan, does that answer your question, or did you want to do follow-up with that?
There's a lot more to it. Ilsadora, so that's newmedicine.ca, has a whole series of blogs on COVID, where she's a lot more lucid than what I just said.
No, that was great, Catherine. Thank you so much.
Okay. It's pretty much a disaster for many people, what's happening with COVID. But in the bigger picture, I do see it as a spiritual turning point for humanity in disguise.
I do too.
Yeah. So that's what keeps me positive in these times.
Yeah. Thank you.
Welcome.
So Marie Sylvie was asking, can you offer us the reference to learn more on COVID symptoms from that perspective?
Yes, newmedicine.ca. That's Ilsadora Laker, a brilliant teacher and practitioner.
Right. Mary Sylvie, did that answer your question? Maybe she can't go off mute. That's okay.
Okay.
Oh, if she said yes.
Good.
Okay. She typed it in. Perfect. That was all the questions I can see in the chat window.
Okay.
So unless there's anything else, then I guess we can probably end up for closing up for tonight.
Okay, we'll go to our final sound meditation.
We can do a little bit of more of a sound meditation. Yeah, so thank you so much, Dr. Willow. This has been another incredibly informative evening, and I look forward to more of this and learning more, putting this to practice in our lives.
Yeah, I hope you come join us sometime in the study group.
I think that I probably will be. Yes.
You're an amazing practitioner, Rebecca. I mean, you already are.
I'm pretty excited about it. Okay, so I'm going to play, instead of a crystal bowl this time, a little bit of a steel tongue drum, and then the pushy time. So just, we can just feel into our hearts, feel the gratitude for the breath, and just enjoy a little bit of sound.